Getting into the healthcare industry is not for the faint of heart. Amazon and other companies are trying to disrupt the giant and inefficient U.S. healthcare sector. As the Wall Street Journal says, they've made little headway, but a crop of upstarts is offering industry giants a chance to buy their way in. Analysis from Paul Seegert, managing partner at the benefits firm PCS Advisors. Paul, what's going on?
Well, I think we're seeing a little bit of an arms race to take over primary care, or that the continuation of how primary care has evolved. The history behind us in the rearview mirror, you had hospital systems that bought up primary care docs. It's tough to be a small practitioner anymore independently as a primary care provider. They did it because they wanted to control where the primary care sends people. The real money gets made at specialties and when people get admitted to hospitals. And if you own primary care, you can direct traffic. You kind of turn them into salespeople, and I know they don't like me saying that, but that's kind of what's happened there. And then now we're seeing these large healthcare and not healthcare companies like Amazon, CVS, Walmart, Walgreens, all making big moves through acquisition mostly, or joint ventures into primary care. Walmart partnered with United Healthcare to do this, I think to kick it off in Florida and Georgia, where you could have access to primary care in their stores. CVS bought Signify Health, Aetna, bought Caremark, Amazon, One Medical, which is what that article you referenced points to. And these folks are all spending billions of dollars to get control of primary care.
All right, so they're spending billions. I presume that would help them make billions as well. So would any of these efforts, these mergers, the acquisitions, partnerships, would any of that help the individual healthcare needer?
Well, yeah, the consumer can benefit from convenience. I think COVID, our whole experience with the pandemic, accelerated adoption of virtual care, which has positives and negatives like anything else, but it's definitely, I think, a good part of how we can provide healthcare in the future. The downside that I see potentially is the fact that in this business of healthcare in this country, where you and I have talked before, we don't really have a good free market system, and there's such a lack of transparency. What I've seen historically is that consolidation actually leads to higher costs because you have less competition. A good example of that would be large hospital systems that go into rural areas and buy up the small hospitals. We can come back a year later and prices have gone up 7 to 9% in those markets. So they come in saying, hey, we're going to create efficiency and bring our big, large-scale solution to drive down costs, but they actually tend to use it as an opportunity to increase cost and eliminate competition. And if we see that same thing happen here, I think that's the concern that I would or the thing that I would watch out for.
Yeah. We're speaking with Paul Seegert, managing partner at PCS Advisors. We're talking about efforts to disrupt the healthcare industry. Why is it so hard?
Well, you think the military-industrial complex is strong. I'd say the medical-industrial complex, which maybe none of us call it that, but maybe we should start, is really strong. And the lobbying power is unmatched. And that has led to a system where players can operate without transparency, and we've created maybe not monopolies, but we've created, to use too big of a word, an oligopoly. You only have 4 or 5 big insurers left. You have these big players, and that's why Amazon has failed to really disrupt to this point, even though they've made multiple attempts. JP Morgan Chase, Amazon, and Berkshire Hathaway worked together, formed a joint venture to attack this thing and shut it down. And Amazon, in the end, started Amazon Pharmacy, which was not at all disruptive, really just added another source of revenue for Amazon.
Wow.
So it's a tough thing to change.
What about that pharmacy entity that Mark Cuban put together?
I like it. That's one of the only things I've seen come along in recent years that is truly has the potential to be disruptive. Lots of things get called disruptive, and in the end, they kind of just pile on. This one has the potential to be truly disruptive because he has come out and said something that sounds simple but is really not. It's a big thing. He said, I'm not going to take insurance. By doing that, the insurance industry has no say over what he charges a customer for a drug.
All right, thanks, Paul. Paul Seegert, managing partner at PCS Advisors.